right, online folks, will you let me know if you can see our slides and hear me right now? Perfect, thank you so much. All right, we're gonna go ahead and get started with our next speaker. Let me get a laser pointer for him first here. You can see it in the corner of the slide here.
Okay.
It'll show up very nicely on these dark blue slides.
And I use a trackpad?
Yep,
okay.
Exactly. And then you can advance here or with these arrows.
Okay. Sounds good.
All right. Our next speaker is Dr. Greg Anderson. He is one of our two board certified surgeons, along with Katie Myers, who is doing double duty right now, but she's out on maternity leave. So I'm going to turn it over to you, Dr. Anderson.
Thank you. Is my microphone on? I think it is. Okay. All right. Well, thanks everyone for showing up on this beautiful day to talk about a subject that might be a little dry, I guess. Hopefully everyone will stay awake after lunch. You know, when I select these topics, right or wrong, I usually like to pick something that where I'm going to be able to learn something as well. And so I don't really consider myself an expert in this area, but I wanted to talk about it. And so we're going to look at the background of gonadectomy. We're going to talk about all the various effects of neutering, and then some take-home messages. So we've all been subjected to these questions, and certainly in a primary care setting, more so than specialty. But the question always comes up, what age should I spay or neuter my puppy, my kitten? What have you heard about ovary sparing surgery? And then, you know, what should we spay my dog, since you told me that, you know, these tumors are hormonally influenced? And there was a time where some of these answers were pretty straightforward and not really up for discussion, but those times have kind of changed. So these days we have to consider a lot of things. One of those is the effects of gonadectomy on a dog's weight, and I think we've all witnessed this, where neutering a female or a male dog can increase its weight. You've probably heard about some studies looking at longevity. A group of Rottweilers, the famous Rottweiler study. You'll probably hear about how intact Rottweilers live longer. And then you also hear about ortho issues, hip dysplasia, elbow dysplasia, cranial-cruciate ligament disease, all those things. And then the urinary system. Female dogs, spayed, incontinence. And then what about feline, now called interstitial cystitis? What, if any, kind of connections are there? So those are kind of the new issues, I guess. Some of them aren't so new. And there's also neoplasia. Are dogs and cats that are spayed or neutered, are they more likely to develop neoplasia compared to intact animals? So we're going to look at some of these things. And then obviously you balance that with the obvious. Unwanted pregnancy, if you were to keep your dog intact or your cat intact. Pyometra. When I'm done with this lecture, I'm doing a pyometra on a big Mastiff. It's probably going to end up being about 8,000 bucks, something like that. So it's not a cheap endeavor. There's obviously behavior issues with having intact animals around. And prostatitis and abscesses. They say things come in three. In the last the last month I've seen 3 prostatic abscesses. And so also expensive to treat. and not an overnight resolution, I might add. Perineal hernia. And obviously, there's some effects with keeping a dog intact with that. So these are the things we got to kind of balance. But, you know, some of these things might be overstated. And I'll admit, I've been always kind of in the camp that, well, you know, there really isn't enough information to make a recommendation about delaying neutering a dog or a cat to try to avoid some of these conditions. But I try to challenge myself in what I think. So it's been a while, so figured we would revisit this to see what evidence there is to support either side of this balance. Well, where did we get 6 months? You know, this is kind of hard. I tried to find out more about this, but it's probably just to maximize size and to capture them before their first cycle, so they don't have the behavior of an intact dog or cat. And then, but if you go on the other extreme, these patients are often quite small, and it makes anesthesia. It's a little bit intimidating for some veterinarians, and so I think that's kind of how we got around 6 months. When I was looking for a photo of a dog displaying intact behavior, I came across this photo, and I'm sorry to say, I've learned that dogs have sex toys. And this is a sex toy that I found on Amazon. It's for your dog to have its way with, and it has well, I'll let you look at it. It's something I'd never seen before, and I kind of wish I hadn't. There's also pre-pubertal neutering, which is hard to say. And this is young age neutering, and it's often done in a shelter setting in order to minimize the chance that they escape, you know, the shelter's ability to spay or neuter them. It's a little more technically demanding, and so often these are done in a shelter setting with somebody who's experienced in prepubertal neutering. And so that's, you know, around 6 months. That wasn't always the case. Most dogs and cats were neutered really early in age, sometimes as young as 4 weeks in male cats. But then things kind of shifted to the 6 to 9 month of age. And it's probably due to a few things, with the pet becoming part of the family, medical advancement as far as anesthesia and being able to anesthetize younger patients. There's also, you know, the information age, right? We have clients who have Googled everything, and sometimes, you know, they come in with what they think should happen, and sometimes it's not always the best plan. And there's more owner investment. You know, there was a time where a lot of clients would just do what we recommended, but now people, with their own information, they have a little bit more owner investment. The debate about timing of gonadectomy is nothing new. As far back as the early 70s, there were advocates trying to keep for delaying or not even spaying your female dogs, because it was believed that they would lead a happier life, and that attitude persists in many parts of the world. And but the big kind of controversy, I think, was somewhat triggered by this Rottweiler study. And these Rottweilers were plucked from a database and they're the oldest Rottweilers in North America. And the idea was maybe there's something we can learn from these old Rottweilers. What kind of characteristics do they have that maybe we should be looking at? And so they matched these old Rottweilers. I think they're called oldest of the old, and they matched him to Rottweilers that had a usual longevity, 8 to 10 years of age. And then they kind of looked at when they were, if they were spayed, when they were spayed. And what they found that females were more likely to reach an older age compared to male dogs, kind of like in people. But that advantage is lost if that female dog had an ovarian hysterectomy in the first 4 years of life. Now, that's kind of a roundabout way of saying, okay, there's probably some play here between gonad exposure and in longevity, but it's something that's not obvious. And looking at those really exceptionally aged dogs, you bias the population, which is a common theme with retrospective studies. These animals presented to like universities, teaching hospitals. And so by that mechanism alone, you're already selecting for a certain kind of client. And so it's probably not an accurate cross-section of the pet population. They didn't have a control. And they also mentioned that there could be a familial clustering of, there could be a genetic component. And it just so happens that these Rottweilers may have shared some ancestries and had these genes for longevity, thereby skewing the results. So there's some problems with this study. It does show, and it's kind of tantalizing, but it's far from a definitive study. And the main investigator, David Waters, I don't know if David Waters actually used to be on faculty at the University of Minnesota, I believe, a long time ago. But he's a researcher at Purdue, and he made a quote, and he says himself that this is not an all or none stipulation, and that this isn't definitive evidence that we should stop spaying and neutering our pets. And then there's been some follow-up. And so other breeds were looked at for longevity. And this is a prospective study. It came out of, I think it was Davis. And they enrolled these dogs at about mid-age. And what they found was that these dogs had these groups, spayed female and intact female, had no effect on longevity. So this study didn't find the same results that the previous Rottweiler study showed. And this next study is, I'm just going to try to, okay, I can't move that. Oh, that's better. Okay. So this study is moving on from golden retrievers, Rottweilers to golden retrievers. And this is looking at joint disorders and cancers. And again, this is out of a database at a teaching hospital, and looking specifically at golden retrievers, and they had several diseases of interest. And so basically, they looked at all the golden retrievers and looked for certain diseases. They looked at hip dysplasia, cranial cruciate ligament rupture, lymphosarcoma, hemangiosarcoma, and mast cell tumor disease. And the dark are the intact. The light gray are neutered early, and the dark gray are neutered late. And this rate would be greater than 90 before 90. And found a male and female golden retrievers. And in the male golden retriever, there's quite a difference if that golden retriever was neutered early compared to both neutered late and for the control. So this is the population. Still, it's a rather low population, but it's a significant increase from intact dogs and late neutered dogs. We found similar results, and this was mainly in the male golden retrievers. The female golden retrievers, when it came to hip dysplasia and gender status, these results were not significant. Cranial cruciate ligament disease, definitely early neutering was a risk factor in both male and female dogs. In the female golden retrievers, lymphosarcoma was seen more often in female dogs spayed early. And then there's some other strange, like hemangiosarcoma seemed to spike in those dogs neutered late. I don't really understand why that would be, but that's what these results are showing. We have of conditions here, but certainly some significant differences between these groups when it comes to hip dysplasia in males, cranial cruciate ligament disease in males and females, and lymphosarcoma. Interestingly, when we look at things like hip dysplasia and cranial cruciate ligament disease, a lot of times when a group, female spayed, they develop a cranial cruciate ligament tear, it's attributed to the weight gain after neutering. And they looked at that, and in this particular study, there was no difference in body condition scores between the intact, the late neutered, and the early neutered groups. Also, interestingly enough, none of these dogs, none of the intact female dogs developed mammary carcinoma. And I think this was a 10-year study, if I remember right. So, then this latest group took the same database and they looked and compared golden retrievers with Labrador retrievers. And they looked at some of these conditions du jour, so to speak. They had a little bit of a wider window, 13 years. And so this is how this is broken down. So here's the percentage of incidence of these specific diseases. And the diseases are abbreviated here. This column is the early age neutering, less than 6 months. This column is sort of more conventional, 6 to 11. Then we got 1 year and then late neutering. And the control is the intact male and female. So you can see if you have a golden retriever that was neutered early, you run the risk of that dog developing hip dysplasia or cranial cruciate ligament disease, more so in the male, but also increased in the female when you compare it to the intact male and female. For the golden retriever, it's cross, but there's not much difference between male and female. And I guess you could say less incidence compared to the golden retriever. So those are for orthopedic injuries. And then they went and they looked at mast cell tumor, hemangiosarcoma, lymphosarcoma, things like that. And what they found was that there was basically the Labrador did not have any significant increases in the percentage of these diseases when it came to neutering. And there was a less of effect with these cancers in the golden retriever, but you can see there was a small increase in lymphocytoma, but everything else is kind of close to for the control for this study. Of course, this, like all the other studies that are taken from these databases, they're retrospective and they're only as good as the information written on the record. And, you know, I look back on my record keeping and it could always be improved. You know, and if something didn't get coded right, then it's not going to end up in the database. And the other thing too is, we talked about it before, that in order to be enrolled in this study, this patient had to walk through the doors of a teaching hospital, which by itself kind of biases the population a little bit. Even if they present at the teaching hospital, there's the additional burden of diagnostic fulfillment. So you couldn't just mark it down as having a cranial cruciate ligament tear on a hunch. It had to be confirmed. And confirmation required some tests, and not everyone wants to pay for those tests. So fulfillment, that could also be selecting for a biased population. Here's another way to look at it. So in this study, they looked at necropsies of golden retrievers. And same database. I think this is still out of the University of California, Davis, and then the Corrett School of Veterinary Medicine. And they broke down, the cause of death was broken down into neoplasia and non-neoplasia death. And then they divided up these cases into gender bins: male castrated, female spayed. Okay. And they found that 65 of all the deaths were cancer related. And the mean age was 9 years. Spayed female dogs had more cancer deaths than intact female dogs, okay? And that probably, it makes sense, especially when you look at the median age of a non-cancer death is, you know, about 6 years. In the intact female, it's quite a bit later in the spayed female. And that is mirrored with the males for non-cancer deaths. Okay, you think about dogs roaming, getting into trouble, smacked by a car. For cancer deaths, the median age between the two groups were more close, okay? So about 9 years for both groups. And this study basically concluded that the risk for developing cancer wasn't necessarily related to being spayed. It was more related to longevity. If you live long enough, you're going to get cancer. Okay. And that's really what some of these studies are trying to sift out. Is the cancer something related to hormonal control, or is it just that there are more neutered dogs and cats that are living longer and therefore are developing cancer more frequently compared to intact animals? This is an interesting database because I put this here because this is a private database of golden retriever enthusiasts, okay? And I don't know what kind of, or if there is an incentive to register your dog in this database, but they're captured early. They have to be enrolled before 2 years of age, I think, yeah. And so it captures them early. And then every year, the owner sends in a completed questionnaire, and it asks things like, has your dog been diagnosed with hip dysplasia, cranial ligament disease, overweight, obesity, things like that. And that way you capture, I would think you'd be less encumbered by like financial limitations. But you also think about, golden retriever enthusiasts. Is that a cross section of pet population? I don't know. So in this, they have 2,700 golden retrievers. And so this chart, it's a little busy, but this is the risk of being overweight or obese, looking at these variables. So, and then here, these are the hazards ratio compared to an intact. So if you are a golden retriever and you were spayed less than 6 months of age, your hazard ratio of becoming obese is 1.95 times that of an intact golden retriever. So just about twice as likely to become obese. And then it's more than twice, and then it's a little, these are the hazard ratios here for obesity. And over here, they're corrected. In terms of orthopedic injuries, in this same group of golden retrievers, they also broke it down, less than 6 months, 6 to 12, greater than 12 months. And the hazard ratio for developing, instead of breaking it down into cranial ligament ruptures, they just said any kind of joint arthritis. They kept it kind of simple, which, there's going to be some error with that, but any kind of orthopedic injury or condition gets counted on these questionnaires. And so these dogs that were neutered had an increased hazard ratio compared to intact golden retrievers. Moving on, let's talk about, and that should say physeal closure. That was a spelling correct mistake. And so this is, normally physes, depending on the breed, will close around, and depending on the physis, close around a year of age. Dr. Root at the University of Minnesota did a study looking at kittens and the closure of the distal and proximal radial physis. And they x-rayed these kittens until the growth plate closed, and then they documented at what age that physis closed. And there were 6 kittens per group, males and females, and some of them were neuter spayed at 7 weeks of age. Another group, it was at 7 months of age, and then they left a third group intact. And what they found here is, especially in this distal physis, the intact group, their radial physis closed at about 12 months, what we would kind of expect, okay? These kittens that were neutered before 6 months or even after 6 months, their distal radial physis was delayed in closing, okay? Indicated by these bars here, both in the male and in the female, but more so with the male. Well, what does this mean? Well, it can have clinical ramifications, and that is we see cats with capital physeal fractures, and the vast majority of these are castrated male cats, and they're usually about 1.5 to 2 years of age. And those cats, they looked at these 25 cats, and of these 25 cats, I think 16 of them had like an accurate gonadectomy date. And so they looked at the gonadectomy dates, and they found that most of the kittens were neutered before 4 months of age. And then some of them were neutered later. And this is, again, of all the cats that had capital physeal fractures. So that is a risk. So a lot of times we don't see them in that until they're kind of already trying to heal. So often they're quite chronic. Let's look at osteosarcoma. This study looked at osteosarcoma along with several other conditions. And their osteosarcoma is abbreviated OSC here. And in the female dog, there was quite a difference between neutered females and intact females. Neutered females had an increased risk of osteosarcoma. When it came to males, though, that difference was insignificant, or not significant, I should say. And it's a pretty good study, but it is retrospective. So again, you're selecting, and you're probably missing some cases that never made it to the teaching hospital, or and so didn't get put into the database. Another way to look at this is the odds ratio. And everything in gray is statistically significant when compared to intact. And these are like, odds or hazard, kind of the same thing. The odds of developing these disorders. So like osteosarcoma in a neutered female, you're 2.5 times more likely to get osteosarcoma than an intact female dog. Okay. But again, is it because those dogs are living longer, or is there some sort of mechanism? And I don't think they sifted that out and had cohorts set up. So the other issue that people look at is things like feline interstitial cystitis. And this is out of the Journal of Feline Medicine and Surgery. It's really the only study recently looking at this. And they basically found that there was no correlation between timing of neutering or intact status when it comes to interstitial cystitis. And in fact, what they found is that most of the cats that get obstructed less than 5 years of age, most of those are intact male cats. But after 5 years of age, most of them are already neutered cats. So I don't know how to explain that. Somebody could do that, that'd be great. Incontinence. Okay, this is something that we can kind of see with our own eyes, and the incidence is anywhere from 2 to 30%, depending on what source you look at. And it can happen right away, and there's reports of it happening 10 years after a spay. And the size of the dog also matters too. So incontinence is more likely in larger dogs. If you have a little dog, I'd probably not worry so much on timing. But and a big dog, the earlier you spay them, the increased risk of incontinence. And so that's kind of the take-home message with incontinence. Okay, so this is kind of balanced with the other side of the scale and mammary tumors, because we've all been told that if you don't spay or neuter your dog, your cat, spay your female dog or cat, then they're at risk for developing mammary tumors. And some of these statistics you've seen before, there's a protective effect if you neuter them before their first heat. That protective effect is slightly reduced. Overall, the risk of mammary tumor is still, quite small. And in that one study that had cohorts of intact female dogs, none of the dogs over that 13-year period developed mammary carcinoma. So that could be an overstated risk. Now, in cats, that protective effect also decreases, and there's no protective effect once they reach 2 years of age. And as we know, mammary tumors in cats are most often malignant. Looking at dogs and mammary tumors and their malignancy, there was no correlation between gonadectomy and the malignancy of the mammary tumors. What about those dogs where you're removing a mammary tumor and you have a talk about, spaying that intact female dog? Do you offer it? Does it help? Several studies that I looked at, the answer is no. There's no beneficial effect of removing those mammary tumors. There is a study, and they had 3 groups, and they looked at timing of spay in relation to the development of their mammary carcinoma. And they found that if the mammary gland, if the spay was done within 2 years of the mammary gland discovery, it had, I'm sorry, I'm getting ahead of myself. That's one group, and then they had the dogs that were spayed greater than 2 years from their mammary tumor excision. And what they found was that survival was quite a bit less for those dogs where they were spayed and then more than 2 years had passed, and then they developed mammary cancer. 300 versus 755 days. So this is a little bit weird. Intact. Yeah, that's what you would expect with these groups. I can't explain why the way they did it here with these groups, looking at timing, why there's a difference, whereas the previous study, they don't. I'm not an expert in statistics, but it is interesting. Endocrine disorders. So cats have an increased risk of developing diabetes compared to intact cats if they're spayed, and also hypothyroidism in spayed female dog compared to intact female dogs. And of course, there's considering the culture of gonadectomy. Parts of Europe, they're quite a bit against it, and in fact, it's illegal in some countries to do elective gonadectomy. You got to have some sort of reason. So there's also some of that going on when it comes to decision making. You probably heard of an ovary sparing spay, a hysterectomy, and this is one effort to get around the effects of removing the gonads at an early age. So these dogs keep their gonads, but they're sterilized by removing the uterus. And it's, again, advocated by those who want to avoid some of those hormones, the detrimental effects of hormone secreting ovaries, of removing the ovaries. And one study looked at doing the procedure in cadavers. And so you can kind of see here, this is an ovary, and this is this proper ligament here. And so we've got to dissect the uterus away from that ovary. And what they did is they submitted that cut end, and they found there was I should say uterine tissue. There was uterine tissue all the way up to the cut edge. So what that means is that there could be uterine tissue still in these dogs, okay? And if they still have their ovaries, then you run the risk of that uterine tissue creating, secretions and running into problems, obviously. Also, about a quarter of these dogs had persistent non-hemorrhagic vaginal discharge, and they also had heat behavior, which 25%. That's a bit of a roll of the dice to come out on the other end still having behavior and a discharge. Has anyone performed? Has anyone been asked to? Yeah. Mm-hmm. You can't get a pyometra. A true pyometra requires the hormones. You could get like a stump granuloma. Yeah, I don't know. Ovariectomy, and that's actually a portion of the that I didn't put in this lecture, but there have been studies looking at ovariectomy versus ovariohysterectomy, and there's not really any difference. I've never had an owner specifically tell me, okay, I want you to leave the uterus, just take the ovaries. But that's actually how we do it when it comes to laparoscopic spay. I was asked to do an ovary sparing spay at the time I was practicing in Reno. And so we'd get a lot of eccentrics from the Tahoe area. And but I had a consult, and the owners of this dog were very in tune with it. And ultimately, I never did the surgery because I think they kind of just sensed that I wasn't really. And I told them, like, I'm willing to do it, but I don't think it's the best way of trying to achieve what you're trying to achieve. But anyway, maybe we'll be asked more in the future. Who knows? Okay, so back to our scale and trying to weigh these issues. Some of these, I think, we know that these dogs they can get obese. I think it really is owner dependent. Again, the intact dogs in the study from UC Davis, those dogs had the same BCS score as the gonadectomized dogs. If you think about the kind of, I could see that happening. If you think about the kind of person that brings in their intact male golden retriever, okay, and it's probably a bird dog, and it probably enjoys a good quality of preventative care and therapeutic care. It's those dogs that don't show up at UC Davis, University of Minnesota, that I kind of wonder about. And I'm wondering if we'd see more obesity with people that might be less in tune with their pets, have other things going on, things like that. So to conclude, a couple of things. Longevity was definitely increased with gonadectomy. That one study showed it, and that's the necropsy study. Non-cancerous death was quite a bit younger. So we're talking about trauma, might be talking about pyometra, potentially prostatic abscess, things like that. So, or dystocia. There does seem to be some evidence that there is an increase in cancer rate with gonadectomy, depending on the breed. I think we saw that more so with the golden retriever compared to the Labrador retriever. But sifting out whether this is a factor of age versus some sort of mechanism with the hormone, that, in my mind, there isn't enough evidence to really conclude that there is a direct genetic effect going on. And the orthopedic issues with hip dysplasia and cranial cruciate ligament rupture, I think there is something to that. I think it's all related to the physis, and when you correct for body condition score, you still see the differences. So I'm inclined to think that it's real. I think there are other factors at play, and one thing that would be interesting is looking at like muscling and activity levels. Okay, all these pets, they have varying degrees of activity, and so that would be interesting. Almost all of these studies have some degree of population bias because most of them are retrospective to some degree. And whenever you do that, you're missing some cases, and you're also relying on the medical records. And neutering does protect against mammary gland cancer, for sure. And early neutering increases risk of incontinence. So I've learned a little bit, and I've shifted my attitude a little bit when it comes to gonadectomy and the timing. And I would love to hear if anyone else had some experience with any of the issues we talked about. And thanks for your attention. Question?
Do you know of any studies that looked at complication rates for bigger, especially like a very hysterectomy, doing it young versus old? Because in our clinic, we've kind of decided that doing it younger, if possible, is better, especially in large giant breed dogs, because just the risk of complication as they get older, these 2 and 3-year-old fat giant breed dogs.
Yeah, yes. So the question is, are there any studies looking at complication or ease of surgery, things like that, when it comes to neutering, let's say, a 2 to 3-year-old female large breed dog versus an 8-month-old large breed dog? Just because of their size and maybe the tissue. And by age 2 or 3, they've already had a chance to become obese. Although they're still intact, they still, a lot of times they can become obese, making surgery harder. I'm not aware of a study looking at that, but it'd be interesting. But yeah, I don't remember coming across a study that looked at that specifically. Yeah.
You said that your recommendations have shifted. So what did you recommend and what do you recommend?
Yeah. First of all, I avoid the use of the word recommend. And I'm pretty transparent in that I have no problem saying that we don't know. And a lot of times I think people want a quick answer. My breeder said to wait until they're 2 years old to neuter them. Is that good advice? And they want to hear yes or no. And I basically tell them it's not so straightforward. And whereas I would say we don't know and it's not so straightforward, now I kind of qualify it with there is some evidence to indicate that real early neutering might increase your chance of incontinence. And I do talk about mammary cancer, you know, pyometra and prostatic abscess. But I now acknowledge that there is some evidence with orthopedic diseases and timing of neutering, whereas I would kind of avoid that. I still avoid the topic for the most part, unless a client wants to talk about it. It's not something I delve into for sure. But I want to be more prepared and be familiar with the literature so that I can make an accurate summary, I guess. I'd be lying if I said that there is a recommendation that everyone agrees upon. However, you will find this group out of UC Davis, the Hearts, they publish in this journal, PLOS. It's an open source, and they have actually published recommendations for specific breeds. And so those recommendations are out there, but as we saw, some of it could be, the longevity issue is questionable. And some of the cancer is questionable just because of longevity. And so I think for large breeds and Goldens, I think it would be, if I had a Golden, I would wait until a year of age before spaying or neutering them. That's probably the one breed I would make that, I guess, specific recommendation. And years ago, when I was at the U, one of our residents gave a lecture on this subject, and one of the tenured professors kind of tore into him, saying, we don't have enough evidence to make any conclusions, and went off on all the statistical. Well, it was within a month later that this faculty member got a dog, and I was talking with them, and he had decided to wait until the dog was a year of age to neuter it. So there's what you believe and say publicly, and then there's a decision you got to make if you're in that position. So yeah, that comment was made. Yeah, large breed spays, stressful, and breaks everyone's back, and not a lot of fun. Probably not a big money maker either.
Thank you, Dr.
All right, thank you.
We'll take a quick break and we'll get started again at 3 o'clock. Or sorry, 2 o'clock. Push us ahead an hour.
You don't want to make them stay inside any longer than they.
No.